Okay, thank you for joining us. My name is Lindsay Dale. I'm your Public Information Officer. Today we have members of our Board of Supervisors, our staff, and members of the public here that will be speaking about the new public health order. If you do have any questions, I will remind you that we are broadcasting live on Facebook and Granicus. So if you do have any questions, please speak loud and precise, and also state your name and publication. If we need translating service, Plancarte will be doing that for us, and with that, I will open it up to Mr. Plancarte.
Thank you very much, Lindsay. Good afternoon, everybody. I'd like to thank all of you who have joined us here in the room physically and those joining us online. Thank you for tuning in. I want to begin by expressing my most sincere condolences to those families that have lost a loved one during this pandemic. This has been tough for all of us. We've lost family members, friends, neighbors, those people around us that form our community. The decisions that, as the County Board of Supervisors, we have made over the past few months have definitely been difficult. No question about that. We have based our decisions considering not only the health and the effects of COVID-19, but our community's physical health, spiritual, mental health, and financial health as well. And we take this into consideration every step that we begin to consider towards reopening. Joining us today here are Dr. Stephen Monday, Imperial County Public Health Officer, Janet Angulo, Imperial County Public Health Director, Father Mark Etney, representing El Centro Catholic, and Katie Luna, Executive Director of the Brawley Chamber of Commerce. Before I start with turning the microphone over to Dr. Monday, I am going to try to repeat the same in Spanish for those media outlets that are broadcasting in Spanish. Buenas tardes, me gustaría agradecerle a todos los que nos acompañan aquí presente, al igual que los televidentes que sincronizan por líneas y nos acompañan desde sus computadoras. Quiero empezar dando mis más sinceros pésames y condolencias a aquellas familias y personas que han perdido seres queridos durante esta pandemia de COVID-19. Este ha sido un momento difícil para todos nosotros, ya que hemos perdido miembros de nuestras familiares, primos, amigos, vecinos, maestros y mucha gente en nuestra comunidad. Quiero compartirle que las decisiones que la mesa directiva de supervisores toma y sigue tomando en los últimos meses definitivamente han sido difíciles, no han sido decisiones fáciles, pero siempre las hemos basado considerando no únicamente la salud física o médica de nuestros residentes, sino también el estado espiritual, físico, mental y, claro, el aspecto financiero de nuestra comunidad. Todo esto mientras que consideramos cómo le vamos a hacer para abrir, manteniéndonos todos sanos. El día de hoy nos acompaña el doctor Stephen Monday, él es el oficial de salud pública del Condado Imperial. Janet Angulo, la directora de salud pública también del Condado Imperial. El padre Mark Etney, representando la Iglesia Católica del Centro, y la señorita Katie Luna, directora ejecutiva de la Cámara de Comercio de Brawley. Dr. Monday.
Thank you, Mr. Chairman. So as of today, we're waiting to update the dashboard, but as of today, we have 1,274 positive COVID-19 cases and 23 deaths in the county. Over the weekend, a series of phone meetings took place with the state public health department officials and the county officials for the counties and also the city public health officials across the state. And during those calls, there was discussion about the fact that we are currently as a state in stage 2, but that some of the counties have been able to move a bit faster through stage 2 because they've been able to meet certain variance criteria. This was an update because there was planned to be additional movement, some of which required variance and some of which did not. As I'm sure everyone is aware, we have not yet met the variance criteria, and so therefore we are still in stage 2 in the lower risk. The specific items of interest that were discussed that are applicable to us being at this part of stage 2 was that the state decided as a whole that they would open retail across the state, obviously with the caveat that they would follow the appropriate social distancing and other safety measures that we have discussed many times in the past, and I'm sure we'll discuss a bit more today. In addition, there was a very robust discussion about communities of faith and places of worship, and it was decided that they would move that into stage 2 and allow individual jurisdictions such as counties to decide if their jurisdiction was indeed ready to move forward with allowing faith-based groups to meet. So based on that, I have prepared with the assistance of County Council a amended health officer order that addresses both the ability for retail to now provide on-site services, again following appropriate guidance that has been issued by the state, but also for faith-based and other similar communities as well. So rather than read the entire order, much of it is redundant, I'm going to just emphasize the main points and then point out the things that are new compared to the prior order. So effective today and continuing until rescinded, the following will be in effect for the County of Imperial. Number 1, all residents living within the county are ordered to continue to stay at home at their place of residence with the following exceptions. And the first exceptions are those we've previously mentioned, which is people who are essential workers. Additionally, people are allowed to engage in activities that are deemed permissible by the CDPH, which is the California Department of Public Health. Residents may also engage in activities deemed permissible as detailed by the State Public Health Officer's Order dated May 7th, and is also noted in the state's Resilient Roadmap and the county's Roadmap to Recovery. Number 2, all businesses, nonprofits, governmental agencies, and other entities located within the county shall continue to remain closed with the exception of the following. So the first group are the ones we've previously discussed, which are those that are performing essential work. And also those that are listed in the State Public Health Officer's Order dated May the 7th. Number 3, those entities that are permitted to reopen in accordance with the state's resilience roadmap and the county's roadmap to recovery shall adhere to the guidance for reopening issued by the State Public Health Officer and CDPH as may be amended or supplemented. And then listed are all of those that have met these requirements and have guidelines, and those include agriculture and livestock, auto dealerships, childcare, communications infrastructure, construction, delivery service, energy and utilities, food packing, hotel and lodging, life sciences, limited services, logistics and warehousing facilities, manufacturing, mining and logging, outdoor museums, office workshop, workspaces, places of worship, and again, this is a new one, which I will go through in more detail. So for places of worship, case studies conducted by the Centers for Disease Control and Prevention have determined that certain faith-based activities may increase the likelihood of transmission of COVID-19 to their congregates, and referenced our 2 CDC articles. Therefore, the following additional restrictions shall apply to places of worship. So first, what I will do is list what the requirements are of the state, and specifically what they have required is that the gatherings cannot be more than 25% of the maximum occupancy of the building up to a total of no more than 100 people. Whichever of those numbers is smaller is the number that is allowed. So the maximum under any circumstance would be 100, but in a smaller building, that number will be smaller than 100 again, because it cannot be more than 25% of the maximum. Also, it is necessary to maintain physical distancing, so maintain the 6-foot distancing between people, and to make sure that they're following all of the other hygienic measures that we've discussed on multiple occasions, including washing your hands, staying home if you're sick, and not mingling with people outside of your household. Specifically, although they are allowing in-house worship, and again, up to 100 people or 25%, whichever is smaller, they are not allowing children's church, as an example, or Sunday school, and the reasoning for that is because they don't want children from different households intermingling. Children could attend church as long as they sit with their family in the regular church service, and they're within the number of people that were already described, but they can't be in a separate environment because of the intermingling. The remainder of the specifics with regard to cleaning and separation and restrictions are all listed in detail in the state guidance document that is referenced in the order, and I won't bother to read the multi-page document to you. It will be included by reference. What I do specifically want to point out is that in that document, the first section lists things that are required, and the second section lists things that are strongly recommended. For our local order, we of course are putting all of the required elements in place. However, in addition, so that we have an abundant safety net for our population, wherein we are actually clearly still having a significant outbreak problem here in Imperial County, we're going to add some of the things that were considered to be strongly recommended, and we're going to make them mandatory. Specifically, those are the following. Singing and group recitation shall only be permitted through alternative methods, i.e. internet live and or recorded streaming, telephone, drive-in, etc. Such activities shall not be allowed in indoor facilities. The reasoning behind that is because we've now have published studies that have shown that singing can transmit disease. Several large outbreaks have been associated with this, including some deaths, and including some in which there was then community transmission that also led to a death. So because we know that singing can lead to aerosolization, which is able to travel over longer distance than the 6 feet that we normally discuss for regular COVID transmission, we are not going to allow that to take place. And that includes recitation as well, so things like group prayer and liturgies, because again, when vigorous talking occurs like that, it can also lead to aerosolization and therefore transmission over a longer distance than the 6 feet. In addition, faith traditions that require the kissing of ritual objects, use of common cups, and use of other community property such as pre-printed programs and books shall be discontinued. Activities such as a communion may continue if provided prepackaged and placed on seating areas prior to services. Congregates may bring their own books, communion, or other worship materials to services or other faith gatherings. And again, this is to limit passing of objects from person to person that could lead to transmission. The passing of offering plates shall be discontinued. Places of worship may set up containers where congregates may place their donations. And finally, children must remain with their family group at all times during services or other faith gatherings. Sunday school and other children's services shall not be permitted. Additional groups that are in the state order include ports, public transit and intercity passenger rail, real estate transaction, retail, and as everyone is aware, there is now state guidance for retail that does allow in-store transactions to take place, again, following all of the safety measures and physical distancing that we've previously discussed. Shopping centers, and then for the purpose of the order, as other particular types of industry are brought on board and the guidance documents are developed and released by the state, then we will consider adding those to the order as well. It's important to note that the state still has a recommendation for the use of face coverings. However, the local order for Imperial County, including the new one that I have just signed, does still mandate face coverings. It's not optional, so that pertains to these new environments as well. But it's important to understand that the masking is required everywhere, not just in faith-based gatherings and in the retail environments that we're talking about today. So the rest of this is not different than prior orders, and therefore I will not read them to you. But of course, copies of the document will be provided to everyone once they are finalized. So I'm going to stop there and see if anyone else, Jeanette, if you wanted to add anything to that. And then we have a few other people who will be speaking as well.
I do have a PowerPoint. It's just a brief overview of our roadmap stages, roadmap to recovery. Before I translate what Dr. Monday said, I will not try to attempt to translate word per word, but I will provide you with a gist of what Dr. Monday said in Spanish. Roadmap to recovery in Imperial County. We have the 4 stages, as Dr. Monday mentioned. Within stage 2, we're at the lower risk stage currently, working hard towards meeting our variants here locally. It's very small print, but what I have here for you is the status of the readiness criteria. We are currently meeting one of the 2 metrics within the epidemiological stability. The one in progress is the one, the testing positivity over the past 7 days that we're working on. Protection of essential workers, testing. We're good to go. We're doing quite a bit of testing out in the community. Containment capacity, we've met. Hospital capacity, vulnerable populations, that's another one that's in progress. We're currently working with our skilled nursing facilities to ensure that they have enough supply on hand for at least 14 days. COVID-19 industry guidance. There are key areas for both faith-based organizations and retail sector that we need to look into and have in place. For example, workplace-specific plans, employee and volunteer training, individual control measures and screening, cleaning and disinfecting protocols, physical distancing guidelines, and special considerations are all found within the documents that the state has put out.
Well, first of all, I want to thank you, Supervisor Plancarte, and Chairman of the Board of the Supervisors, for your invitation to speak today. And I want to echo what you said at the beginning in offering condolences to all those who have lost family members in this time of crisis and pandemic, for all the families who are suffering. And that's a good starting point for what I want to say with respect to this opening, slight opening of houses of worship. To me, the most positive development in this is that even with the restrictions that will still be on, that we in the Catholic Church will be able to resume funeral masses. This is very important. I already have 40, just in El Centro Catholic alone, 40 funeral masses waiting. So the grave sites, burials have been done, but the families want to be able to celebrate as they believe. So this is positive. Baptisms, other sacramentals will be, and celebrations of sacraments will be possible. So in this sense, we're very grateful. I want to say clearly, I don't speak for the Bishop of San Diego. I don't even speak for all the Catholic pastors, let alone our Christian Protestant pastors in the Valley. But I do think this is a positive sign. Our people, this is a hard and difficult experience for all of us, right? And if you are a person of faith, and particularly if you regularly practice your faith, the being unable to do that, especially as you're dealing with this, is a hardship that is really unbearable for many. And yes, the Catholic churches and parishes in the Valley, as have the Protestants, we've all gone online. Masses are broadcast every day through Facebook and on websites. I even did a wedding. But imagine a wedding where nobody can come. Okay? So the thing is really positive. I hope this enables us to have a better outreach, pastoral and ministerial outreach to our people. So any progress in that direction is positive. But I want to say the position, as I understand it, of the Catholic bishops of California and the Bishop of San Diego has always been to listen carefully to the guidelines of the health authorities and to the governor, to try to work collaboratively. We recognize that it's our responsibility morally and theologically not only to keep our own people safe, but to keep the wider community safe. So our approach has been one of collaboration, discussion, and agreement. So and sometimes disagreement. But in this case, any step that allows us to pastor more approximately to our congregations is going to be positive. And I want to thank particularly the county authorities and the city authorities, especially in El Centro, for being very willing to discuss with us, pastors, and to communicate with us in this time of crisis that we've been facing. I think the one objection that I have to it, and I would pray that we are going to have some progress as we move forward, is the capacity limits are very hard on our people. Okay, so for example, in my two parishes of Our Lady of Guadalupe on the east side of El Centro and St. Mary's Parish on the west side, I have 4,000 regular Mass attenders on the weekends. What will I do with a capacity of 100? Okay, I mean, do 40 Masses a weekend? Not possible. Not with all the other things. So we will hope to hear from the governor and also from the county some information on how that maximum is going to be lifted. Because what we had been planning, we have been following the guidelines as they've come out. What we had been planning was 6 feet of social distancing. Well, when we have a capacity of, in one church, 900 and another 800, to say that only 100 can get in there as a max is really hard. And I know that any house of worship that has that kind of number of people or that kind of seating capacity will have the same concerns that we do. After all, when we open, and as of what I understand now, both for Imperial County and San Diego County, the Catholic Church will resume weekend Masses on the weekend of the 13th, 14th of June. Okay, but so with that prospect in mind, what am I going to say to 4,000 people? As that, well, only 100 of you can come in. So I'm not complaining. I'm just saying, with all the positive sides of this, in allowing a greater pastoral outreach to our people, allowing us to celebrate some of the sacraments with the capacity limits, with social distancing and all the other protocols, that's all very positive. But it does present us with a serious issue in terms for those houses of worship, churches that have large congregations. And as I say, once more, when we have large capacity churches, we would definitely be hoping for a lifting of that maximum number. For example, we have already in our 4 sites in El Centro, for El Centro Catholic, we have already spaced out the social distancing requirements. So, for example, in our churches, we should be able to get 200 people in. And that's with strict 6 feet distancing in a circumference. So we know, we understood that there were going to be severe limits because of social distancing. To our mind, or to my mind, an arbitrary 100 limit when you have a capacity space of 1,000 or 800 or 900 doesn't seem terribly just. Okay, as I say, I'm not complaining. I'm just saying that we have some real struggles to face, as everyone does. But to open the church, but only open it this little bit, will cause some distress in our community. Overall, I want to say to all of you, to whether you have faith or none, the church is open, prayers are being said, masses are being celebrated. To all our community, we want them to be as safe as possible, but also for their religious and spiritual needs to be met. So that's about all I have to say for the moment. Thank you again.
We'll go on to Katie Rubin.
Thank you, Supervisor Flancarte. And to echo that statement from Father Mark, this whole process has had many levels of complexity, and finding the solution is not an easy one. I'm just going to take a moment to highlight the Business Recovery Task Force and explain. We didn't, as all this was happening so quickly, day by day, we didn't have the opportunity to come out formally and introduce the task force to the community. We got to work right away. So I'd like to just take a moment to recap what the task force is set up for and what we've been able to highlight. And so as the announcements of COVID-19 came to the Imperial Valley, business resource organizations across the community united together to create the task force, Business Recovery Task Force. With a cross-section of local stakeholders, we are supporting efforts to understand the impact of COVID-19 closures and respond quickly with programs, resources, and policy shifts. The task force is working diligently to achieve the following outcomes: business surveying and comprehensive needs assessment, curation of local, state, and federal resources and information, responsive programming that maintains economic vitality, communication platforms to connect and inform businesses, as well as opportunities for the community to come together in a virtual sense. So over the last several weeks, the task force has served as an intermediary between the business community and the county administration, the county health department, and the local health authority. And I just want to take a minute to thank you, Jeanette and Tony and the county, for meeting with the business community representatives and hearing our plea and our messaging, and we really appreciate the efforts and the bridge that's been built between the county and the business community in that sense. We have been and we continue to advocate for the business community to reopen in a manner that protects our employers, our employees, and the consumers. We understand the complexities that have prevented our business community from moving forward onto the next stages of reopening. And here's where we need the public's help. We're still here in stage 2, low risk, and primarily because of the spread of COVID in our community. We still see high numbers daily, and so we are asking for the community's help in this. And we want our businesses to reopen and thrive again, but we can't do it without the community. The number of cases and the spread of COVID-19 is preventing us from moving forward. It's plain and simple. So help us stop the spread of COVID-19 so that we can quickly and safely reopen our businesses. The task force has launched a pledge over the weekend, and we invite all of our community members to join us in taking the pledge at our website, ivbizrecovery.com. I have to say, going into this weekend, seeing counties surrounding us in the U.S., on the U.S. side, seeing the counties opening and moving on to the next stage and knowing that we're just stuck is quite frustrating. Our business community needs to open, they need to thrive, but it is an effort, everyone's effort. We need everyone to take responsibility for their actions and to help us in limiting the spread so that we can move on to the next phase. And so what you'll see in that pledge is a pledge not only to support your local businesses by shopping local, always shop local, but to also abide by their guidelines as you go into their business. Wear your masks, stay 6 feet apart, and whatever guidelines they have outlined to be in compliance. And so the Business Recovery Task Force continues to be here as a voice of business. And we want to thank the partners that we have at our table, the Imperial Valley Economic Development Corporation, the Small Business Development Center, our other chamber partners, the Joint Chambers of Commerce, and Reliance Public Relations. It's a working group that's here to work on behalf of our business community, and we hope that everyone will join us in taking the pledge so that we can quickly reopen our businesses. Thank you.
Thank you, Ms. Luna. So with that, we will turn it over to questions. I know we did have some mediums available for electronic questioning. None have come in yet. So we will turn it over for questions from those of you in the room. Please remember that this is being broadcasted and there are microphones trying to pick up your questions. So please state your name, your affiliation, and speak loudly so that we may pick it up. Vamos a pasar a la sección de preguntas. Recuerden que la rueda de prensa está siendo transmitida por medios sociales. Les pedimos que si van a hacer una pregunta, por favor se identifiquen claramente, hablen en voz alta para que los micrófonos alcancen a escuchar su pregunta. Okay, do we have any questions? I need to see. Yes, sir.
I think it's a question of Dr. Monday. He mentioned something about retail.
Could you identify yourself for?
Thank
you, sir.
You mentioned something about retail, shopping malls or something. Could you clarify what you meant by that?
So the state took actions on two main areas that were statewide. The one that we were just discussing were the faith-based organizations, and the other was retail. And so, as you're probably aware, once we moved into stage 2, the state allowed for things like curbside pickup, but we're not allowing people to go into the actual retail stores. And in the new guidance that just has come out, they are going to now allow people to actually enter retail facilities. Obviously following all of the social and physical distancing measures that we've been discussing. So they have very detailed guidance about what's required, but the bottom line is that they will actually be allowing people to physically enter retail environments now.
Para traducir la pregunta fue durante la presentación habló de que se iban a abrir más negocios. Y eso es correcto. La respuesta del doctor fue que con las nuevas órdenes estatales, los negocios que hasta ahorita no se habían considerado esenciales tienen la capacidad de abrir. Muchos de estos negocios antes ofrecían servicios que uno podía recoger en la acera. Estos son negocios, no restaurantes, para aclarar. Y ahora podrán permitir que entren los clientes, claro, practicando la distanciación social, cubrebocas y las otras precauciones que cada negocio necesite según su tamaño.
Félix Mesa, El Sol del Valle Imperial. Mi pregunta es, cuando dicen retail, ¿están hablando de todos los negocios? Joyerías, peluquerías, salones de belleza. Están hablando también de las oficinas de gobierno, Seguro Social, el IRS, porque la gente nos está preguntando todos los días si el seguro va a estar abierto, el Seguro Social, si el DMV va a estar abierto, si el IRS va a estar abierto, si las peluquerías y los salones de belleza. Entra en el retail, the beauty shops, the barber shops, the jewelry stores, the Social Security Department office, the IRS office, the DMV office, all those things also are in that new order?
So, of course, I didn't quite understand the first part of your question, but the general answer to what you were just saying is that, first of all, things like the DMV and the Social Security and the IRS, those are not retail, those are government services, and they're essential, and whether they will open or not will be decided by those particular governmental organizations. But in terms of the retail environment, it really is divided up by whether or not they are able to follow the various measures for safety that are put in place, including the need for physical distancing. So we're talking about any kind of retail where they're selling something, as an example, but in which there's not a close physical connection between the person that's providing the service and the person who wants the service. So getting back to your specific question, this does not include things like, for example, barbershops or beauty parlors, tattoo parlors, other such places, because that requires a close physical interaction between two people. This is just allowing retail that wasn't previously able to have people come into their stores to purchase various materials, services, again, things that don't require the close interaction of two people, to procure those services in person.
Para contestar su pregunta, algunas de mercancía en ASEAN que ya estaban previamente abiertas.
Y es importante hacer hincapié en que retail indica un artículo de venta, no un servicio, sino es un artículo que se está recibiendo a cambio. Entonces, creo que eso ayuda a clarificar los servicios personales, esos que incluyen perder la distancia y incrementan el tiempo en el que se está uno exponiendo. Any more questions? Yes, ma'am.
Hi, Alex with KYME News. Is it also the capacity for retail? Is it also 25%? And so does this include like the Imperial Valley Mall? And what does that mean for the mall?
So as I said, there's specific guidance that's out that the state put out. I have a copy here. You can go on and get a copy of this yourself to look at it. The way this industry guidance is done is it talks about those prevention practices that Jeanette showed in her slides, including the physical distancing, the face coverings, if you did use the hand washing, the training. So it's not just about the number, it is about the need to physically distance. There's nothing in the document that says that there's a 25% number specifically. It's more about their ability to maintain the physical distancing and do all of the other things that are required.
And I would like to add that one of the interesting things you're going to see, for example, at malls, and I have not spoken to the mall here in El Centro, but they are going to come up with a mixture of businesses. And so within the mall, they have retail, they have restaurants, they have those that provide nail and hair. And so they will have to work within, although the mall itself may to a certain extent open, they will have some limits for those sectors that are located within the mall. And they will work with those and working with the clients and the business owners with that. La pregunta que se hizo por el canal KYMA era que si el 25% de distanciamiento también era aplicado a los negocios que venden a mayoristas, menudistas, cosas así. El 25% no aplica a ellos, el 25% tiene que ver con las organizaciones de fe, museos, creo también incluía el 25%, si no mal recuerdo. Pero lo que sí es importante, se estaba usando como un punto de referencia lugares como el centro comercial, la mall, como les decimos. Ahí va a ser un poquito diferente del punto de vista que pueden abrir, pero como tienen una mezcla de tipos de negocio, tienen restaurantes, que los restaurantes ahorita nomás pueden ofrecer servicio para llevar. También tienen negocios de servicio directo, por ejemplo, uñas y corte de pelo, que esos todavía no están en vigencia, y luego hay los negocios que venden productos. Entonces, lugares así van a estar abiertos, pero van a estar limitados, limitando cada sector y trabajando con los propietarios del negocio y el público para manejar cada sector en especial a sus requisitos. Do we have any more questions? Yes, ma'am.
Again, Alex with KYME. Question for as far as the places of worship, I know it's the state's guidelines that say the 25% capacity. is there opportunity for the county to loosen that up, just countywide? Like how the Reverend was mentioning that he's able to fit 200 that are 6 feet apart. Is there any opportunity for that to be loosened up once we get like our numbers down, or what are the?
So the answer is no. If we can make it stricter, we cannot make it less strict. So if we wanted to say we were limiting to 50 or 10%, that we have the ability to do that, but we cannot make it less strict than what the state standard is. So for us to move to a larger number, the state will have to change their parameters.
Okay, well, thank you very much. Oh, we do have
Sorry.
one.
I just have one more question. I
Sure.
know that for St. Mary's, there were some, oh, sorry, my name is Janelle Giglino, I'm with KYMA. I know for St. Mary's, there were some talks that it would become some sort of shelter for COVID patients. I don't know if it was as an extension of the hospital. I don't know if you could tell me a little bit more about that.
Thank you. I think the question is whether St. Mary's would become an extension, a mobile hospital or something
Yeah,
for the.
something
No,
along.
that has not. I have not been approached for that. For probably use of the parish, and no one has approached me for that. I'm only guessing here, but it may be because I'm the board of president of the board of trustees at Imperial Valley College, so we did make the decision to open the gym as a temporary hospital. So maybe between my association with St. Mary's and IVC it came back. But I have not been approached by any public agency for that permission.
One more comment. Just one more comment for the larger retail. We expect that they will have their plans in place. They'll be able to work with their companies to develop that plan. But for our small business community, it is a guideline it is mandated for each business to have a plan in place, a work site specific plan, so that you're ready when your business opens. If you're already open, you need to develop that plan as well. We have developed with the Business Recovery Task Force and the Public Health Department, we have developed a worksite specific plan that you can tailor. So you just fill it in, it's fillable. You can add in the measures that you're taking for your business. And so if you need assistance in creating that plan, we have a template for you. We've made it easy. We don't want that to be a barrier for businesses to get up and running. So you can check that out at ivbizrecovery.com or on the Imperial County Public Health Department website as well.
Thank you, Ms. Luna. Jeanette?
I would just like to end with this comment that we are here talking about stage 2 low risk, trying to move into stage 2 high risk. There's stage 3, there's stage 4. As a community, we really need to work towards meeting parameters that have been set, but not only parameters that have been set, we really need to move into the upcoming waves in a very safe and healthy manner. Let's think about midterm, long-term, and what it means for Imperial County, what it means for us. Again, I will reiterate, it'll take every single one of us to make a difference in this community, to help stop that spread of COVID-19. If at any time the situation worsens in Imperial County, the last thing we want to do is move back into stage 1. All that ground that we have gained, we don't want to lose. I highly encourage you to take the needed precautions and stay safe and stay healthy. Don't let your guard down and work with your public agencies. We're very grateful that we've been working for a couple of weeks now with the Business Recovery Group. We've been meeting with the faith community. We've been planning because we want to reopen, but we want to reopen in a very safe and healthy manner. Thank you.
I would just like to reiterate what Jeanette said. I mean, we are still in stage 2, and this was a statewide move, and we want to make sure that we keep the people in our county safe. And so these guidelines with regard to the size limitations and with the physical distancing were put into place to make sure that we can do these things and still keep people safe. And we have to keep in mind that if we have a worsening of the epidemic here in Imperial County, to Jeanette's point, then that means we have to move backward. That means more people get sick. That means more people might potentially die. That's why we're being cautious and why we're moving slowly and trying to use data to drive the decisions that we're making. We, of course, want to support the business community, but we want them to be safe. And it's my belief, and it's our belief, that with these new openings, the retail and the places of worship, that if they will follow these guidelines that have been put out, that they can operate in a safe manner, and that's why the guidelines were developed.
Thank you. So in closing, I'd like to remind everybody of a few things. Although the state of California either recommended or strongly suggested the face coverings, Imperial County will continue to stay with it just because of the current outcomes that we have. Remember that the faith-based organizations, it is optional for those pastors and those priests at each one of their facilities. Everybody has a different congregation, different demographics, different size, and everybody will make their own decision. Retail shops that are opening up, I ask you that you help them get back on their feet, shop local, but also respect the face covering. You have to wear it outdoors all the time. And please, as you're helping them, do not help or do not cause them to have to go backwards themselves. And last but not least, in the English version, testing. Remember that we are still testing very high per capita. I think we were at 29%. That means that, last week we were at 24. We've increased 5% of those being tested, testing positive. Whether it's the Mother's Day bump or not, I do not know, but I am very, very concerned that we are going the wrong way. We're really supposed to be at around 8% or lower, 1/12 instead of a quarter walking towards a third. The only way that I think that we can continue to make a big impact in that and help our community be open is by increasing those amount of tests being done community-wide. So I encourage you, go test it. Encourage those around you to go get tested. There should be ample testing in the community. Unas palabras para cerrar. Recuerden que el cubrebocas, aunque el Estado de California ha dicho que es una recomendación o una sugerencia que tienen, el condado de Imperial lo toma como un requisito. En cualquier momento que estemos afuera en grupos y no podamos mantener la distanciación social de 6 pies o 2 metros o más, se tiene que usar siempre en público. Para las organizaciones religiosas, recuerden que es la opción de los representantes de esa organización el sí abrir o no abrir. ¿Por qué? Porque cada quien tiene congregaciones diferentes, diferentes edades, diferentes tamaños de edificio y tal vez para unos funcione, para otros no, pero cada uno va a decidir. Para los pequeños empresarios que van a poder abrir y vender sus productos, los invito a que visiten sus negocios, les ayuden a recuperarse, compren local lo más posible, pero también ayúdenles a protegerse, a proteger sus negocios y a protegerlos a ellos. Y eso es usando cubrebocas, la distanciación social y no causar que uno de esos negocios tenga que cerrar porque no lo protegimos. Y lo último, hacerse las pruebas. Ahorita estábamos la semana pasada 24%, casi una de cada 4 personas que tomaba la prueba estaba saliendo positiva. Ahorita hemos subido como un 5% más, estamos en 29 en vez de bajar. Tal vez sea por la falta de distanciamiento que tuvimos el Día de Madres, no hay forma de saber exacto, pero me preocupa. Les invito a que se tomen la prueba. Mientras más nos tomemos la prueba y haya números más grandes comunitarios, podemos bajarlo. Necesitamos estar en el 8% o menos, o sea, 1 de cada 12, y ahorita positivos estamos saliendo 1 de cada 4, casi 1 de 3. Les agradecemos que nos hayan acompañado y por favor, manténganse sanos. Thank you for joining us and please stay healthy.